Hi, my name is Tashira. I'm with the Youth Empowering Strategies, and I'm interviewing Dr. Martinez.
My name is Dr. Jaime Martinez. I am a senior attending in the Division of Adolescent Medicine, Department of Pediatrics at Stroger Hospital. I'm also an associate professor of pediatrics at the University of Illinois, and I'm also principal investigator of the Adolescent Trials Network, the Chicago site.
What made you interested in working with adolescents and adolescents medicine?
So in your third year in medical school, you are doing clerkships. You do rotations through different departments and disciplines. And the ones I was mostly interested in was pediatrics, and also I was interested in adult medicine. And then as my education progressed, I became more interested in pediatrics. And then within pediatrics, there's specialties. So my interest was working with young people because I felt there were certain populations of young people that get paid very little attention. And I also was interested in intensive care, working within the intensive care units. But I also wanted a social life. And so I felt if I was in intensive care, I would never have a social life because you're in there constantly, even when you're on call. And I felt I could learn a lot from young people about what was going on in the world. I think many issues politically and economically affect young people first, from my perspective, before they affect others. And I thought it was a good way to keep in touch with what's going on in terms of contemporary issues, but also be able to offer them health care.
Have you learned anything new about adolescents that you didn't think before?
In working with them, I've been able to learn a lot in terms of how they become infected, why they become infected with HIV, how society has not really shared resources for HIV as they do with adults to help these young folks prevent from getting infection and prevent them from getting sicker. And I'm also learning about the violence that exists in many of the lives of these young people who wind up being in jail, for example.
Are you involved in any team promotion or prevention programs?
We have prevention programs that go out into the community, and these prevention programs will educate young people about sexually transmitted infections, HIV, how to protect themselves from getting these sexually transmitted infections, and we also test.
Do you think that these prevention programs are helping the teens?
I feel that they help educate the teens. The programs are also helping youth understand whether they have HIV or whether they don't have HIV, and then we counsel them depending on whether they are or aren't to continue to protect themselves and others from getting infections.
How do you think your work is contributing to building a better community?
I think that by providing good health care, by being a role model, by learning from you all, young people and others in the community about what the needs are, I think will strengthen our community.
What do you think as us teens should do to build a better community, or prevent, kind of be more involved in preventing HIV or stuff like that?
I think that young people are a force to be reckoned with. You guys, when you reach the age of 18, can vote. And so you can start getting in the political process. But even before you reach the age of 18, as volunteers, you can help programs like ours and like Y.E.S to be taken out into the community, and also to give them feedback on whether their programs work or don't work, right? Because it's really important. If we're developing programs for young people like you, it's important to hear whether they are actually effective, right? And the only way we can do that is if we work with you to tell us whether they work. So, for example, the research that I do and that my coworkers do at the Core Center, we take young folks who are in the research projects and young folks who are in our clinics, and we bring them together into a community advisory board. So we actually get feedback. The young people are involved very intimately with the research that we do. And another thing is that you all give us ideas about new things to do. For example, when we started our HIV services, we had one young man approach us and tell us you know, it would be really helpful if we can have somebody else who's our age, who's HIV positive, meet with us and tell us what life is like for them. And so we developed a buddy system, a peer buddy system. We have a young person who has HIV, a guy and a girl, and they sit in our clinic and they do peer-to-peer.
If you get your perspective from somebody that actually is going through what you're feeling, they're going to be able to connect more.
Right.
I know you were saying earlier that, you know, for people, for the research to work, you know, people have to come, you know, like, they think, like, you know, they're test monkeys and stuff like that, you know, testing stuff. Do you have a lot of people that come test, like, you know, you guys have the pill, you know, you were saying the pill and stuff. Do you have a lot of people that come test it to see if it works?
Yes. But it is an effort to recruit young people from the community to enter into the studies, because there's this fear among the community, like we were discussing before, that research is all about using our community as guinea pigs.
Yeah.
But if we don't test the drugs on our own people, we don't know whether they work. And so if we just test them out on other communities, then it's going to take at least another 5 years to bring the test back to our communities to see whether these medicines work, or if a certain prevention strategy works. So it's really important for the community to get involved.
Okay. What were some of your dreams, aspirations as an adolescent, and what were some barriers to attaining those dreams, and how did you deal with any of those barriers?
Okay. Well, I grew up in the projects in New York. My dad never earned more than $5,000 a year, and there were 10 of us that he had to support. So it was a struggle to, first of all, live in the projects. There was a lot of violence in the projects. And there was nobody in my family who was a doctor. And I had thought about becoming a doctor or a teacher, but mostly a doctor. As a result of my mother getting sick and the ambulance refusing to come up to the 8th floor, which is where we lived at, they refused to come to the projects. And so I wanted to try and change that. So becoming involved with ASPIDA, developing an ASPIDA program in high school also helped. And also working then with college students in ASPIDA helped me also to think about going to college and thinking about medicine as a career. So ASPIDA, I think, played a very important role in my life.
To become what you want.
Right. And my parents, of course, were always very encouraging.
Okay. So what does it mean to you to be receiving an award in Roberto Clemente's name?
You know, I've received awards before, but when it comes from young folks like yourself, and particularly when it comes from the community, it's very, to me, it's like very heartfelt. And so I'm very honored that the community, particularly through young folks, are considering giving me this award. So I'm very honored.
I think you should be honored because, you know, you've done a lot. And I was reading through your resume, and I was standing how much work you have done. And it's like you're changing a lot the community, all the things you're doing. Like, you know, you're working with our teens and, you know, trying to prevent HIV. I think, you know, you're a very good person.
Thank you for saying that.
Thank you.
Finish with the name.